healthcare providers work in a very stressful environment. There is a very high prevalence of anxiety, depression, post-traumatic stress disorder, and burnout syndrome. Add on top of that a pandemic where they have all of their beds full, the mortality rate has increased, fears about personal safety and the safety of their loved ones are piled on top of that. We're seeing a lot of providers in distress. So when I started this program, I first started it as research. So trying to understand if writing your trauma narrative or writing about a stressful event was effective at reducing these symptoms of distress. When COVID-19 came about, we were trying at our institution, we were trying to think about different interventions that we could offer our frontline providers right away to have the biggest impact and to potentially improve mental health symptoms. So we rolled out this writing intervention as a program instead of research, just to reach as many providers as we could. And what's different about this program is we do have someone reading it, and we do have mental health care providers responding to them. And in addition to promoting cognitive flexibility and reframing of the experience, what I've heard from healthcare providers over the years doing some pilot work with this intervention is that they really like the fact that someone is reading it and hearing what they have to say. And that's especially true now with COVID, where they feel very alone and vulnerable and as if their voice wasn't heard. We have just under 1,000 participants, and it seems like we get 20 to 30 new people enrolling every day. And we're seeing some common themes in the narratives: being worried about their own personal health, being worried about bringing the virus home to one of their loved ones, just the amount of death and dying that they're dealing with, and not necessarily these patients with chronic health conditions, but younger patients being between the ages of 20 and 40 that are otherwise healthy that come in and don't do well with this virus. But then also just the general mental health of our providers. We have a lot of providers that are writing about just the emotional toll that this has had on them. What I've seen so far is that there's been about a 10-point reduction in perceived level of stress. We've had feedback ranging from, I was having suicidal thoughts, to now, this has really been a lifesaver and a game changer for me. I feel like I haven't been heard through this entire pandemic, and I feel like this has been an outlet that has allowed my voice to be heard.